is Michael, and we're going to talk about the Hospital of Misfit Toys, or put another way, the hospital where it just can't seem to get new device acquisition and implementation right. I chose this topic because it's something I've had some experience with, and it's something that a lot of places struggle with, and really a lot of the reason why either some hospitals overspend a whole lot of money, or the reason why some hospitals never move on to new technology is because they either don't have a process for getting new equipment and new devices, or they've been burned before and are really reluctant to go forward again. So the problem, this is just from the case study that I chose, says the hospitals decided to purchase some new pieces of equipment to be used in their facility, and you, me, has been assigned to work with a group to decide the best course of action evaluating and recommending equipment for purchase. The hospital that we work for has a history of purchasing equipment without getting feedback, and recently that came back to bite them to the tune of several $1,000,000. So we're going to come up with a equipment acquisition and implementation plan to prevent that from happening again. So the reason why I chose this one is because of these two devices right here. And if you look up here, then you see the CMAC video laryngoscope. Some of you may have some experience with that in your facility. It's very similar to the GlideScope or the McGrath or a number of those other ones. And if you look over here, you see the Envy ventilator. And I chose this topic and these two particular devices because the CMAC was given to us in transport with virtually no evaluation and no explanation and no input from our stakeholders. Our stakeholders, of course, being the people who are going to use the thing. And the rollout was really clunky, and it caused some problems. Now, spoiler alert, moving forward, this went really well eventually, and we adopted this and warmed up to this. And honestly, to me, the CMAC is the best video laryngoscope out there, especially for using out of the hospital, which of course is not where most of us work and practice. Now, the Envy ventilator over here, entirely different story altogether. Still, we were kind of given this ventilator in transport without any kind of evaluation or buy-in or input from the staff, and it turned out to be an absolute boondoggle. It just didn't do well with transport. It really wasn't durable enough, and virtually nobody uses it anymore. But these two devices really kind of paint the picture for why you have to do a really good, exhaustive process for evaluating, selecting, and then implementing new equipment. So when you think about what we do to go through equipment evaluation and adoption, first you have to establish a purpose for the equipment. So why do you need this? So if you think about, say, a video laryngoscope, for example, why do you need that? Well, the data is reasonably clear that video laryngoscopy works a little better, has a little better first pass success than direct laryngoscopy, especially if people learn that from the very beginning. So, and even if your studies don't bear that out, then having video laryngoscopy as a backup for difficult airways has been proven over and over again to be useful. So you have to establish a purpose for why you're getting the equipment. Your purpose may be that your equipment is old and worn out and you just need something new. So ventilators is a good example of that. They become old and obsolete, or they just wore out. So you got to get something new. You have to consider cost. Cost is a big deal, obviously, in a big corporation. If you're not buying one ventilator, you're buying 100 ventilators, then what you're doing with the money to buy 100 ventilators is really, really important. So you always have to consider that. Maybe something you have to phase in over years and years. And some of that can be absorbed in the capital budget. Staff buy-in. Okay, these are the people that have to use the devices. So it's important, at least to some degree, that your staff is on board, they want to use the devices, they can use the devices, and they see the need for the devices. So trying to give them some piece of equipment that has absolutely no purpose, it's just going to add work to their day, is going to be a disaster. One One thing that's often overlooked when you think about shiny gadgets is the consumables it takes to go with them. I always think about this as what I call the razor blade effect. So, buying a new razor usually is pretty cheap. Buying razor blades is wickedly expensive. And so when we think about buying ventilators or buying IV pumps or buying anything like that, you always have to factor into that what the cost of the ventilator circuits and the filters and the water traps and all that kind of stuff is going to be, and if that's going to be cost prohibitive. Do you have this stuff on hand already? Is it something that you can use the equipment you already have or already buy, or is it adaptable to the other stuff that you already have? If you can use one single circuit for everything, then you're in good shape. And then finally, you have to think about physical and practical durability. Not only is the machine going to stand up to the rigors that you're going to put it through, is it going to stand up to the evidence-based medicine that's going to come behind it? And are you going to be delivering ventilator modes and ventilator methods which are going to be supported by the evidence in 5 or 10 years, and you're not going to have to phase them out to get something new? When it comes to buying anything, then there's the action plan includes things like speccing it out. What do you need? What do you need to do? What does your ICU ventilator need to do? And then you have to go through bids. Everybody hates bids, but almost every, at least moderately sized corporation, requires you to have 3, 4, 5 bids from different manufacturers to provide the device that you want to have. So you kind of got to go through that process, and that's got to be included in your committee. If you're lucky, you'll have a chance to trial some ventilators or equipment or whatever it is, and then be able to compare those. There's a reference we're going to talk about in the next slide where it talks about the importance of comparing multiple devices at one time, so you really can see how these things perform, not only in taking care of patients, but in taking care of patients at the same time. Finally, this is going to come down to who has final purchase authority, like who can do this, who can really buy the device, and that's really the person you're going to have to convince that you're doing the right thing. And the big day comes where you buy it and you work on getting it in there, and then you begin the training and implementation process. Implementation, this goes back again what we said before in the last slide about evaluating multiple devices simultaneously. So you can really believe not only that you have the device that's going to work for you, but the device that's going to work for you be durable, be practical, and going to give you the best bang for your buck. Also need to include a literature review in there to make sure that, again, to use the ventilator example, this is what we're most accustomed to, that the machine you're going to use is going to be applicable and clinically relevant based on the current evidence for the long haul, so you're not wasting your money and having to spend it again in a few years to get something new. Things that get in your way, a little bit of hurdles, staff dissent, and this happens every time. There's always going to be somebody who doesn't like getting a new piece of equipment or doesn't like this particular piece of equipment, or we didn't use this where I came from, we should have this other thing. You got to figure out how to deal with that. Unforeseen events, that was one of the things with that ventilator I talked about in the first couple of slides was, it didn't hold up for us. Everything about it seemed like it was going to be great, and it just didn't last. And we just couldn't see that coming, so we had some problems. And of course, you're going to have cost overruns, and this can kind of be prevented, or you can think about this in terms of your consumables and thinks about, how many circuits am I really going to need? Am I going to have to, test and fail a bunch of stuff? So that's just some thinking that goes into that. How do we measure success when it comes to implementing the new equipment? We get it approved, we buy it, we deliver it, we train on it. Training's a big thing, and one thing that's often overlooked is, it may take another 3-4 weeks to implement a piece of equipment and get it out there just to make sure you train on it effectively. And then finally, you implement it and get it out there to the patients. Another important thing too, and one thing that committee would be responsible for, would be a post-implementation evaluation period to make sure that this machine not only is delivering what we said it would, but it's actually taking care of the patients the way that we said it would. And we're going to get that by talking to our stakeholders, our physicians, our other providers, patients if that's possible or applicable, and to our staff, and make sure that everybody is on board and this machine is doing what we need it to do. If we put all this stuff together, we're going to have a really good experience. We're not going to have those problems of costing us a whole bunch of money having to buy equipment over and over again, or having cost overruns or recalls and stuff like that. And we should have a good experience. Thanks a lot for watching. Here's the reference, and I look forward to hearing from you. Thanks.